In the 1960s, new opportunities for research and medical education would prepare doctors of the future for practicing with new medical technologies. However, doctors would also face new challenges with the advent of corporate medicine. Noted author Paul Starr, professor of sociology at Princeton University, said in his book, The Social Transformation of American Medicine, "By making healthcare lucrative for providers, public financing made it exceedingly attractive to investors and set in motion the formation of large-scale corporate enterprises." Medicare began with President Johnson's administration. The cost of medical services rose from 3.2% a year in the 7 years before Medicare to 7.9% annually during the 5 years afterward. It was under President Nixon's administration that government passed regulations and legislation to hold down the cost of health care. Some of these organizations are health maintenance organizations in 1971, agencies reviewing proposals for new hospital projects, professional standard review organizations reviewing Medicare payments to hospitals, and state agencies limiting duplication of hospital services. In the future, more doctors will be in group practice, more hospitals will be in multiple hospital systems, and more insurance companies will be directly involved in providing medical care through HMOs.
I do not like the way things are going to the centralized government. There's a marvelous thing with doctors being free. They work for you, and they can't get that understood by the public. When they work for somebody else, they're not working for you. If they got 10 doctors employed by some HMO somewhere, and a cost containment meeting that morning says no more this expensive, no more this expensive thing, and we can only have 3 operations out of this whole bunch, so decide who they'll be. And you're not going to get, they won't tell you that. The doctor will come to you and he'll give you something less. And they're not working for you now, and I think you should realize that they are under different constraints when you put them under government, and I don't like it one bit.
Whether you like it or not, if you're in medicine, you're in politics. And those of us that have been there, and I was a lobbyist for 10 years in Trenton. When I used to come home from Trenton, I hope they get this on television, I used to take a shower, okay? Came home afterwards, at the end of the day, take a shower, clean myself off. I got out, I was still so grimy after leaving. I had to go back in and take a second shower to get rid of all of the corruption and the abuse and whatever.
Paul Starr discusses the relationship between health care and patients' rights. Medical care figured prominently in this generalization of rights, particularly as a concern of the women's movement and in the new movements specifically for patients' rights and for the rights of the handicapped, the mentally ill, the mentally challenged, and the subjects of medical research. The new health rights movements were also concerned with rights in health care such as the right to informed consent, the right to refuse treatment, the right to see one's own medical records, the right to participate in therapeutic decisions, and the right to due process in any proceeding for involuntary commitment to a medical institution. The Medical Society of New Jersey took on the fight to protect patients' rights to health care benefits. The Medical Society worked with government regulators and legislatures in creating a fair health care system that both protected patients' rights while keeping down the cost of medicine. The Medical Society worked with the State Department of Health to develop an HMO report card challenging the insurance companies to provide the care promised in their contracts. The Medical Society worked with the state government to bring family care and kids care, which are federal programs for the poor. The Medical Society also supported the Vaccine Injury Fund to pay for patients injured by vaccines.
One of the main things, and actually it started as a seed in the State Public Health Council, where a lot of patients we see it today, running out of money to pay their medical bills. I thought it wouldn't be a bad idea to try and see if I can get a catastrophic health insurance relief fund for children for New Jersey.
I opened up the first laboratory in infectious diseases in virology in New Jersey. I also developed one of the first fellowships in infectious diseases in New Jersey, and I've trained more people in infectious diseases than anyone in the country. Not only we were the first to describe HIV disease and set up the largest clinic in New Jersey.
Myself and my OB colleagues, Dr. Arlene Bartigas, and others had the abilities to write a grant called 076 that gave the first pregnant women who were HIV infected a drug called AZT, which was the first drug to treat AIDS.
In a highly industrialized environment such as New Jersey, is chronic exposures, for example, to solvents in our oil industry or to other unspecified chemicals in our pharmaceutical industry. In particular, in the 70s and 80s, our emphasis changed from the just simply response to incidents in the workplace to a more preventive practice, and that we call occupational health.
We worked on many different issues. One of them was mental health parity. We really never had mental health parity before, where if people would go into the hospital for a mental illness, they had a very small amount of money that could be spent on their care. It might be less than $15,000, and that would cover a lifetime. I also worked on a bill on prosthetic parity, and that bill became one of the strongest bills in the nation.
I think what I'm most proud of about this organization is they're focused on the patient and on public health and increasing health status. And I think a great testament to that, at least in my tenure here, has been the tremendous investment the society made in trying to achieve smoke-free air legislation. Public health legislation like that doesn't directly benefit doctors in any way, but certainly increases the health status and certainly is a core piece of our mission in terms of protecting public health.
Over the course of the life of a young kid graduating with an MD today, over his lifetime, the population of the United States will grow by almost 60%. The numbers of doctors in the United States in that same period will grow less than 30%. So we can't teach medical students now to practice the way we do. It's too time-consuming, it's too inefficient. Doctors in the future are going to have to depend on other members of the team to do a lot of things that we do now.
I come from a medical background. My mother was a nurse. My father was a physician. I grew up with them discussing medicine at the dinner table all the time. I sit in an unusual position as the president-elect of the Medical Society of New Jersey because my father is a past president of the Medical Society of New Jersey. I'm a firm believer in organized medicine. Organized medicine speaks for everybody. We have a profession. We have a profession that is as honorable as any other profession, more so than most.